This is a comprehensive exam for the pediatric course of 5310. Here's a panorama of the room. Okay, and I will not be using a piece of paper. Hi there, my name is Abby. What's your name?
Carrie.
How old are you, Carrie?
25.
25, all right. How are you doing today?
Doing well.
Good, okay. So male appears alert, well groomed, affect appears to be good. Can you tell me where we are?
We're in Fort Worth.
Okay, do you know the date?
It is the 9th.
Okay, do you know what time it is?
8 o'clock.
Okay, very good. And then, let's see, a male is alert and oriented, white Caucasian. So I need to do a comprehensive head assessment. I do need you to take your shirt off for that. We'll start with the skin.
Okay.
Okay, thank you. You can remain standing. I do need her to be able to see you. So I'm going to assess the skin for, there's no erythema, edema, or lesions. Turgor is good. Bounce back is good. I need you to please turn around. Okay, we do have multiple freckles between 1 and 4 millimeters diameter. There is no lesions or masses or rashes. I'll look at your legs as well. Okay. Thank you. You can go ahead and turn around and take a seat. Let's see. You're still on the camera. Okay, so skin looks excellent. I'm going to go ahead and look at your nails. Nail beds are intact and firmly adhered. There's no rigidness or spooning of the nails. Capillary refill is less than 2 seconds. I will check your feet as well. Capillary refill on the feet is 2 seconds. Please put your nails together like this. They are connected at a 160-degree angle. Very good, thank you. Okay. And nails. Okay, so I'm gonna assess your hair now. We have thick blonde terminal hair. It is well dispersed on the head, no patchiness or alopecia. Do you feel any tenderness here?
No.
Okay. Head is normocephalic. No tenderness is noted. And there is also no infestations of the hair. Very good. Okay, so now we will go to the eyes, ears, nose, throat. Okay. Oh, I do need to assess your neck. Let's look at that. Neck is non-edematous. Head is upright in midline. Let's see, trachea is midline. I'll go ahead and have you stand, and I'm going to stand behind you. Okay, I need you, I'll assess your thyroid. Right now it's non-palpable. I do need you to swallow. Very good. Can you tilt your head to the left and swallow? Tilt your head to the right, swallow. Okay. Thyroid is non-palpable. Do you feel any tenderness there?
No.
No masses are noted. So I do need, you can go ahead and sit down again. And I'm going to feel your carotid pulse on the right. 2 plus over 4 plus. On the left, 2 plus over 4 plus. I'm going to listen with the bell of my stethoscope for any bruise of the carotid arteries. Okay. No bruise of the carotid artery are noted. Now I'm going to assess your lymph nodes, your occipital, your post-auricular, pre-auricular, tonsillar, submandibular, submental, precervical, post-cervical. Will you shrug your shoulders? Like this. A little bit more forward. Okay. Supraclavicular. Spread your arms out like this, please. Axillary, and then epitrochlear. Was any of that tender?
No.
Okay. Lymph nodes are non-tender and non-palpable. Now we'll move on to the eyes, ears, nose, mouth, and throat. So we'll start with the vision exam. So I would start with, this is the Snellen test. I would start with 20 feet away, have him cover his right eye and left eye. And then both eyes, and he would read the smallest line, and then we would assess his vision acuity for farsightedness based off of that. So we'll test nearsightedness from 14 inches away. So please cover your right eye. We'll test your left and read the smallest line that you can read of numbers, please.
374258.
Excellent. And that is 20/30 vision of the left eye. Go ahead and cover your right eye and uncover your left. Uncover your right eye, I'm sorry, and read the lowest line that you can of numbers, please.
374258.
Okay, great. That's 20/30. And then uncover both eyes and read the smallest line that we can.
374258.
Okay, good. That's 20/30 vision. I'm going to assess your pupil size. So if you'll just look straight ahead. Pupils are a 6. Let's test your face is symmetrical. Okay, very good. I'm going to hold this between your eyes. I'm going to shine the light in your eyes. Make sure she can kind of see. Will you face the camera a little bit? Okay, very good. I'm going to shine it for just a minute. Can you look up at me? Awesome. And look at your right pupil for reactivity. We're going to shine in your right pupil. I'm going to check your left pupil. Pupils are a size 6, equal, round, reactive to light, and well accommodated on each side. I am going to look at your eyes with the ophthalmoscope. There it goes. Okay. If you'll just look here. Good. Let's see. There is no retinal hemorrhages noted. The optic disc is round and distinct. Then let's see here. I'm going to palpate. The eyebrows and eyelashes are well distributed. The eyelids are soft. Close your eyes, please. The eyeball is firm. Sclera is clear. Conjunctiva is pink with no redness, moist and intact. Lenses are clear. I do believe that's all for the eyes. So I'm going to go to your ears now. So I'm assessing the position, and the pinna is in line with the lacrimal gland. I'll assess your right ear first. Let me switch my covers. Okay. Do you feel any tenderness?
Nope.
Okay. Right ear cartilage is firm and non-tender. So let's see, right hand, right ear. I'll pull the pinna up and back. Okay. The ear canal is pink and intact. There's a bit of cerumen. I can see the tympanic membrane is gray, pearly, and intact. There is no perforation. With a cone of light at 5 o'clock. Okay, was there any tenderness there?
No.
Okay, let me come assess the left ear. Do you have any tenderness?
No.
It's non-reddened. The cartilage is firm, so I'll hold it with my left hand, pull the pinna up and back. Okay, the ear canal is intact. The tympanic membrane is pearly gray and intact, no perforation. The bony structures are intact. Okay. All right. I do want to assess your hearing as well. So if you'll please stand up. And I'm going to stand 2 feet behind you and let me know what words I'm whispering.
Apple pie. Pretty maple.
Okay. That is the cranial nerve aid is intact. I do want to go ahead and do the air to bone conduction. So I'm going to go ahead and I'll put this right behind your ear and tell me how long until you don't feel the vibrations, okay?
Okay. Don't feel it.
Okay. That was 4 seconds, and then tell me when you stop hearing them in the air.
Don't hear them.
Okay. The bony prominence was 4. The the bone conduction was 4 seconds. The air conduction was 8 seconds. So that is a 2-to-1 ratio the air conduction is twice as long as the bone conduction. And so we'll do the same thing on this ear. Tell me when you don't feel it anymore.
Don't feel it.
Okay, that was 5 seconds. Then tell me when you stop hearing the vibration.
Don't hear it.
Okay, bone conduction was 5 seconds, air conduction was 12 seconds. So that is greater than 2-to-1 ratio from bone to air conduction. Okay, so that was good for hearing and ears. Let's go ahead and assess your nose. Let's see, nose is symmetrical, firm. Nostrils are patent. I will go ahead and look in. Okay. Let's see, nostrils are pink and intact. Looks like they are moist with no erythema or exudate coming from there. And then, actually, let me finish here. I'll assess your mouth. Go ahead and say ah. Oral mucosa is pink and intact. Let me see your throat. Good job. The tonsils are 1+/4+. Let's see. The palate is pink, moist, and intact. I do see 32 teeth with no appliances or missing teeth. I will go ahead and palpate your lips to assess for firmness and intact. They are pink, moist, and intact. The rest of the facial exam, I see fine to coarse blonde hair, well distributed. Has ears, nose, and throat. So there's no erythema or swelling of the throat either that I noted on the oral inspection. Okay, so now I want to assess your chest, and so just go ahead and relax. The AP to transverse diameter is 2-to-1. Breathing is non-labored. Chest rise is even and symmetrical. Chest itself is even and symmetrical. So I will go ahead and test for the bronchophony with the tactile firmitis. So if you'll go ahead and say 99 as I move my hands.
99, 99, 99.
Okay, if you'll go ahead and turn around. And I'll do the same on your back.
99, 99, 99, 99.
Vibrations and resonance are felt throughout. Go ahead and sit down for me, please. I'm going to go ahead and auscultate your lungs with the diaphragm of my stethoscope. Go ahead and just relax and breathe regularly. Okay. The bronchial breath sounds, inspiratory is greater than expiratory. The bronchovesicular inspiratory was equal to expiratory. The vesicular breath sounds, expiratory is greater than, inspiratory is greater than expiratory. If you'll go ahead and stand up and turn around, I would like to listen to your breath sounds on the back. Inspiratory is equal to expiratory. Inspiratory is greater than expiratory, and up here the expiratory was greater than inspiratory. While I have you standing, I'm going to go ahead and let's see. I'm going to percuss all of your lung fields for to assess for resonance and no dullness. Good. If you'll turn around, I'll do the same thing here. No hyperresonance noted on percussion. Okay, I believe that that's all I need to do for your lung sounds. So now I'm going to do a cardiac assessment. And so I would like to assess the apical pulse in 3 different positions, but for the purposes of this video, I will only inspect on the left side. So if you will lie down on your left side, just make sure that you stay in the view of the camera.
Like this?
Yes, and you can just relax your arm. Very good. Oh, you know what? I didn't count your breath sounds. His respiratory rate over the minute was 15 breaths per minute. Okay, so I will be assessing his apical pulse. If you'll go ahead and just lie flat. I'll be going in the mid-clavicular between the 5th intercostal space to find the apical pulse. You can lay there for 60 seconds. All right, 67 beats per minute. If you'll go ahead and roll over onto your back, I'm just going to assess to make sure that there are no thrills or heaves of your chest as your heart beats. Okay, the heartbeat is not visualized through the chest. There's no thrills or heaves. You can go ahead and sit up, and I'm going to auscultate your heart sounds. So we'll start with the diaphragm of my stethoscope. And that assesses for higher pitched heart sounds. I'll go ahead and start on the right of the sternal border in the 2nd intercostal space, where S2 is greater than S1, and that's the aortic valve. This is the pulmonic valve. In the left of the sternal border in the 2nd intercostal space. Erb's point is the 3rd intercostal space. S1 equals S2. In the 4th intercostal space is the tricuspid valve. S1 is greater than S2. And then mid-clavicular 5th intercostal space is the mitral valve. S1 is greater than S2. I'm going to flip and listen with the bell of my stethoscope in the same position. So this is the aortic valve, pulmonic valve, Erb's point, tricuspid valve, and mitral valve. Okay. There were no bruits or murmurs or extra heart sounds auscultated with the bell or the diaphragm of the stethoscope. So I'm going to assess your pulses. We'll start with your temporal. Pulses are 2+ over 4+. We'll do your brachial. 2+ over 4+. We'll do your radial. 2+ over 4+. We'll do your posterior tibial, which is behind the malleus, just 2+ over 4+, and your dorsalis pedis, which are both 2+ over 4+. Pulses are equal and strong throughout. Let me think. That will conclude our cardiac assessment. So we'll go to the abdominal assessment. If you will lie flat on your back, we'll make sure that she's able to see you. Okay, if you'll scoot down just a little bit so you're a little bit more flat, you can bend your knees if you need to. Okay, excellent. So I'm just going to inspect the abdomen. For peristalsis, which I see none of, it is symmetrical, and the skin in this area is tan and pink. So now I'm going to auscultate all 4 lung songs with the diaphragm of my stethoscope. All four quadrants. The right lower quadrant, the right upper quadrant, the epigastric area, the left upper quadrant, and the left lower quadrant. Vowel sounds are active in all 4 quadrants. Right. Let's see. So now I will percuss all the quadrants. Some resonance heard on the left upper quadrant. Do you feel like you have gas or anything right now? Okay. But dullness throughout all the quadrants, and I'm going to inspect the sides of the liver. So there's some dullness heard. Okay, from there to there. And we'll measure the liver in inches. The liver is 7 inches in diameter, and then we'll do the same to the spleen. Percussing for dullness. The spleen is 5 inches in diameter. This is percussion. So now we're going to do a light palpation and a deep palpation of the abdomen. It might be a little bit uncomfortable, but I need to know if there's any tenderness, and I'm also assessing for masses, okay? Let me know if you feel any tenderness.
None.
Okay. All 4 quadrants have been assessed. No tenderness so far, so now I'll move into the deep palpation. Okay, did you feel any tenderness there?
Nope.
Okay, no masses were palpated, no tenderness noted. I do need you to stand up, please, and turn around. Okay, and then I'm going to test for CVA tenderness. Did either of those hurt?
No.
Okay, good job. So let's see, that's the conclusion of our abdominal inspection. So now I'm going to assess your gait. If you come stand right here and walk for me. Posture is upright. Gait is steady and even. Coordination appears to be very good. Perfect. You can stop right there. Now we'll assess for scoliosis. So I'm going to go ahead and have you stand right here. Shoulders are even. Hands fall down mid-thigh. Hips are even. Knees are evenly in place. So I'll have you turn around. And go ahead and bend over. Okay, and then hands are even to touching. We don't quite touch the toes, but they reach evenly far. Stand up slowly, and I'm going to feel your spine as you come up. There is no curvature of the spine. Posture is upright and straight. So scoliosis screen is negative. And now we're going to do your passive and active range of motion. So go ahead and face the camera here. I'll go ahead and have you stand for this one. Going to flex your neck, extend, and hyperextend. We'll look to the right laterally, left or laterally, and then turn your head down. Good. And then, very good. And then your left ear to your right shoulder. And then your left ear to your left shoulder. Okay, I said it wrong. So now we'll do active. So let's flex, hyperextend, go to the right, left, right ear to right shoulder, left ear to left shoulder. Okay, range of motion of the neck is good. So now we're going to assess the shoulders. We'll start with your right one. So go ahead and flex. We'll do our active range of motion first. Hyperextend. Let's abduct, adduct. Let's see. Inversion, and extroversion. Good. And we'll do that passively now too. Okay, so I'll have you flex, extend and hyperextend, abduct, adduct, inversion, and extroversion. Okay, and now we'll do the same thing with the left shoulder. So we will hyperextend, flex, abduction, adduction, inversion, and extroversion. Let's go ahead and do that actively. Flex, hyperextend, abduction, adduction, let's see, inversion, and extroversion. Okay, which one else do we need to do? We did shoulders, neck, wrist. So we'll go ahead and we'll do we'll do passive first. So we'll flex, extend, hyperextend, abduction, adduction, inversion, and extroversion. And so let's do that actively. So flex, hyperextend, abduction, adduction, inversion, extroversion. Okay. And then what else do we need to do? Wrists, and let's do your feet as well. Okay. So I'll go ahead and have you flex plantar, flex dorsalis, inversion, extroversion, abduction, adduction. So we'll go ahead and do that passively. So we'll flex, abduction, adduction, inversion, extroversion. Passive and active range of motion is positive in all joints that were tested. After range of motion, bless you. We did gait, scoliosis, and range of motion. Let's see. I believe now we'll go to the cranial nerves after musculoskeletal. So with this, we'll assess for sensory and motor function. Okay. Before that, let's go ahead and test your coordination. I want you to do the rapid hand motion back and forth. Good. Okay, now I want you to touch your nose and then touch my finger with your finger. Good. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Very good. Touch your nose again. Good. Coordination is intact. So cranial nerve 1 is the olfactory nerve, and that will assess sense of smell, which we won't be doing for this testing purpose. Cranial nerve 2 is the optic nerve, which we've tested with the visual exam, and that is intact. Cranial nerves 3, 4, and 6 are the ocular motor nerves, which are intact as evidenced by the cardinal field of gaze. Let's see. Cranial nerve 5 is the trigeminal nerve. That is some facial muscles, so I'll have you smile. Okay, excellent. And then I'm going to have you close your eyes, and we're going to test for sharp and dull sensation across your face. Okay, so I need you to tell me what you feel and where you feel it, okay?
Okay. Sharp left cheek. Dull right cheek. Sharp right cheek. Dull left cheek.
Okay, very good. So cranial nerve 5, the trigeminal nerve is intact. Cranial nerve 7 is the facial nerve, so we're going to assess for motor. I need you to smile, frown, puff your cheeks, open your eyes wide, and squint your eyes. Good. The motor function of cranial nerve 7 is intact. We would assess sensory function by testing sweet and salty on the tip of the tongue, which we will not be doing for these testing purposes. Cranial nerve 8 is the vestibulocochlear nerve, which we assess with the hearing test, but we can go ahead and assess again. So I'm going to stand behind you, 2 feet behind you, and I need you to tell me what I'm whispering.
Apple pie. Pretty maple.
Good. Cranial nerve 8 is intact. Cranial nerve 9 and cranial nerve 10, that's the vagus nerve. Let's see, so I need you to swallow. We would test your gag reflex. Go ahead and open your mouth. The uvula is midline. Go ahead and swallow. Okay, very good. The uvula, the whole mouth went up with the swallow function, and so that would be cranial nerve 9 and 10 intact. And we'll take his evidence by that his gag reflex is intact.
Thank goodness.
Let's see, cranial nerve 11. That's we'll test that by shoulder shrug. So we'll test motor function. Will you shrug your shoulders for me? Good. Cranial nerve 11 is intact. And then cranial nerve 12 is the hypoglossal nerve. So go ahead and stick your tongue out. Move it to the right. Move it to the left. Cranial nerve 12 is intact. So now we'll go ahead and assess the deep tendon reflexes. Okay. So we'll start with your, I want you to stand up for the first part of this, please. I'll make sure that she can see. Okay, we'll go ahead and assess your biceps. Okay. We'll do your left bicep. Okay. We'll do your right tricep. Go ahead and relax. Just rest here. Okay, very good. Relax. Just rest on my hand. Let's make sure she can see. Rest. Okay. The bicep and the tricep deep tendon reflexes are 2+ over 4+. We'll go ahead and do the brachioradial. Okay. So the radial deep tendon reflexes are 2+ over 4+. We'll do the patellar. I believe that's what it is. Go ahead and take a seat, please. Scoot back and let your feet dangle. We'll do your patellar reflexes. Very good. The right and left reflexes are 2+ over 4+. I need you to go ahead and stand up and then put your left knee on the bed and let your foot relax. Okay, we're going to do your tibial reflex. Okay, and then good. We have a negative Babinski as evidenced by no flexion of his left foot. Go ahead and put your right knee up. Okay, we'll do the tibial reflex. Okay, and the Babinski reflex is negative as evidenced by no flexion of his foot. Let's see, and then we're going to test your sensory function. So I'm going to do that by touching different areas of your body with this dull sensation and the sharp sensation. So I'm going to have you close your eyes, okay? And tell me where I'm touching.
Left arm sharp.
Good.
Right arm smooth. Right hand sharp. Left hand smooth. A smooth right leg. Sharp right knee. Sharp left knee. Smooth left leg.
Very good. And then we'll do the same thing with vibration. So tell me if where you feel the vibration, okay?
Okay. Ready?
Close your eyes.
Left arm. Right arm. Left hand.
Oh, that was loud.
Right leg. Left leg. Right foot. Left foot.
Okay. Sensory function is intact. Let's see. So we did our deep tendon reflexes, our gator scoliosis. I think that we've covered everything. Do you have any questions for me?
Nope.
All right. Thank you so much for your time.
Thanks.